I really want to make this video for everybody out there who, if you're a CNA, if you're a patient care tech, or you're NAT, whatever the case may be, I really want to make this video to just talk to you all and give you all this message. So first and foremost, I was a CNA for about 2 years before I became an LPN, and being a CNA really encouraged me and motivated me to become a nurse, and it really made a difference. But what I really want to say today is that you all need to know that you all run whatever facility you're in, a hospital you're running, because you all make the difference for a patient. You see them most of the time. You notice acute changes more than we might notice, right off the bat, because you're taking care of them, you're cleaning them, you're doing more for them physically than what a nurse or a doctor would be doing. So just take pride in what you do. No matter if you feel like, oh, all I do is just wipe butt all day and that's all I do. Like, I'm not doing anything. This is worthless. Like, what's the point? Like, what's the point of me doing this? Like, that's all I do. Like, I'm at the bottom of the totem pole. Like, who cares? Yeah, that might be true. You might be at the bottom, but guess what? We need you. We need you so much to be there for the patients, to take care of them, talking to them, giving them that kindness and that tender care that CNAs and patient care techs can do for a patient. It makes such a huge difference, because especially when you're dealing with demented people or people who are very depressed, it's just small things. You smiling at them, you talking to them, giving them respect. You every time you see them, you tell them your name, you tell them what you're going to do for them. It makes a difference in people like that, because they need to have that consistency, and they need to know that somebody cares about them. It's just imagine, not ever really, only time you touch somebody is if they're picking you up and putting you in the bed, or if they're wiping your butt. Nobody's hugging you, nobody's holding your hand, no one's looking you in the eye asking how you're feeling, and actually, trying to do something for you. It's just imagine that, going like that for years and not having any type of real connection to a human being. But CNAs, you can make the difference in making that connection to your patients, being there for them. And I know it's hard. A lot of times you're understaffed, you're underappreciated. You feel like the nurses get all they do is sit down and deal with paperwork and give out orders. Some nurses, that's all they do, but for the most part, it's a big job. But you don't even look at that. Don't even think it's not fair. That just focus on what you're doing. Focus on your patient. Yeah, that patient might curse you out, slap you, call you all type of different things. But I'm telling you, they really appreciate what you're doing. Even if they can't verbalize it to you, even if they do verbalize something, it's all negativity. They appreciate what you're doing. They need you, and we need you in the nursing field, in the medical community. We need you all to take pride in what you do and just be confident in what you're doing, and just know that you make such a huge difference. I can't stress it enough, and I really appreciate all the CNAs and patient care techs and NATs out there who realize that, and who just take it on. Like, you know what? They take pride in combing their patient's hair a certain way, or getting them dressed a certain way, or, I made sure her nails were clean, her face, she had her makeup on, all that. I know a lot of times you don't have the time. It's pretty much impossible, the constraints that get put on workers, especially in a nursing home, especially if you're in a big nursing home. There's a lot of do this. Oh, and yeah, it's only going to be 4 people working. You're going to have about 20 patients. I need you to do it all by 7 o'clock, and you have about 30 minutes to do it. Yeah, it's unrealistic. It is. I completely agree with you. But do what you can. Continue to do what you can. Continue to tell your nurses what's going on with your patients. You might have a nurse who doesn't even care. She's gonna be like, oh, or he or I, like, oh, okay, that's cool. But keep that communication open. Keep uplifting one another. Keep just trying your best to be your best and to do your best. And I don't know if this, message is going to resonate with people really, but I just wanted to say that I really appreciate everybody out there that's doing what they can for patients at any level. And don't think that you're not worthy. Don't think that what you're doing is stupid or pointless. It makes a huge difference. A huge difference. Even just smiling at your patients. Giving them the dignity and respect of closing the curtain so that their roommate doesn't have to see them getting changed. You know? Giving them a decency and respect of just saying, you know, I'm going to do this, okay? We're going to do this. Even if they're demented, let them know. Just doing that and just connecting with these people as humans. Just looking at them as human beings. Not just a body that you have to take care of, right? But looking at them and seeing them as a human with feelings, with emotions, with kids, with parents, with all these other issues that's going on in their life. And you're that person there that can either make or break their experience. So I hope this has somewhat, you know, connected with you all in some type of way. Please leave comments, like, and subscribe, and just let me know what you think about it. And in all that you do, remember, stay forever true. Peace.